Hi guys, it's me, Dr. Vicente Firmalo. Today we'll be talking about rhinoplasty. So what is rhinoplasty? Rhinoplasty is a procedure which deals with the nose. Rhino for nose. Now, there are several aspects of rhinoplasty. It's not just looking at the nose per se. You have to look at the nose in relation to the face. Okay? It has to have some sort of balance between the face. No? There are different proportions which make up the face, and we have an idea of what kind of balance there is with rhinoplasty. Now, in rhinoplasty, there's what we call augmentation rhinoplasty. Right? Augmentation rhinoplasty deals with putting something to make it more enhanced. Okay? Such like an implant, for instance. We can put a silicone implant, or maybe Gore-Tex implant, or a polytetrafluoroethylene implant. Or we can also do an autologous implant, which means it's part of your body. You can get rib, or we can get ear cartilage, for instance, or maybe the septum of the nose, and put it at the tip, for instance, to enhance the way the nose looks like. Okay. Aside from that, we can also trim the nose, the alar base, the alars or the nostrils. We can also trim that, make it thinner, make it smaller. All right. We can enhance or improve the tip of the nose. And as I said earlier, we can also enhance the nose bridge. Okay. So it depends on what the patient wants. Okay. So you have to communicate to your plastic surgeon what kind of nose are you desiring, and it will also depend on which kind of tissues you have. You cannot make too big a nose if your nose tissues are just small, and you cannot make the nose too small if your nose tissues are very plentiful. So it will depend. So those are the different aspects of doing a rhinoplasty. What are the different nasal implants that we can put? Okay. So there are two major types. One is the silicone, and one is the Gore-Tex, or the polytetrafluoroethylene types of implants. So these implants are used because they are relatively inert, which means that the reaction to the body is less than other substances. Okay. So these are the two major implants that we can use for rhinoplasties. And there's also another type of augmentation material, which is an autologous type of augmentation material. So this means that we can use your own cartilage from the ear or septum, nasal septum, or even part of the rib to enhance particular features in the nose. So these are the different types of materials for doing a rhinoplasty. So different approaches to rhinoplasty. You can use combinations of implants and cartilage, or you can use cartilage all throughout. It will depend on your discussion with your plastic surgeon. It will depend on your expectations and what your needs are. And of course, safety concerns as well. So please be sure to discuss this with your plastic surgeon. So you can do combination, implant, and cartilage, or just pure autologous, or material from your body alone. Hi guys! So what are the different approaches to doing a rhinoplasty? Okay. One is doing a closed rhinoplasty, which means that you do the incision, okay, inside the nostril, and maybe put an implant and enhance the nose bridge. You can also do what is called an open rhinoplasty. An open rhinoplasty involves cutting through the columella, So this is what we call the columella. Cutting through that, extending the incision up to the inside, and lifting up the nose. so that we can fashion the cartilages better, and we can also at the same time do some trimming of the nostrils as well. So those are the two types of general rhinoplasties, no? Open and closed rhinoplasties. Of course, the different types of subtypes will depend on what your needs are. So communicate that with your plastic surgeon. Thank you for watching my YouTube channel. Please like and subscribe.